Public health services are often a provider of first choice within their communities. They act as a safety net for Victorians who may otherwise struggle to access services that meet their needs. The aged care and disability sector has undergone a significant amount of change to the way they deliver care and support since the introduction of the federal aged care reforms and the NDIS. To support these changes, the VHA has been delivering a capacity building and transition support function. We're working with health services to ensure that they can flourish in a changing and competitive environment. However, delivering inclusive care is often complex and challenging. As a result of this, we have partnered with other peak bodies and organisations to develop a range of simple to use and tailored resources for health services. These resources include an inclusive care organisational self-assessment, an options for change resource, and a series of short videos. The VHA would like to thank those involved in the development of these resources and the Department of Health and Human Services who fund our capacity and transition support functions.
So Alzheimer's Australia represents over 97,000 Victorians currently living with dementia, and by 2050 that's expected to reach 387,000 with no cure in sight for dementia. So that's the group we represent. In terms of the range of services we provide, we do a lot of advocacy work as the peak body for dementia, counselling services, education services, a range of information and support services for people living with dementia, but also their families and carers.
So VAL's LGBTI Ageing and Aged Care undertakes research and specifically works with aged care service providers and health and human services providers to understand the specific needs and experiences of older LGBTI people.
So the Salvation Army State Social Command works across the whole of Victoria, delivering services in out-of-home care, family violence, drug and alcohol services, mental health services, homelessness services, and a range of other services to the most disadvantaged people in Victoria.
Our reason for being is to support our members, non-government disability service providers, in their provision of disability services to people with disability, their families and carers. And we also provide a large number of services to our members and indeed to the wider sector to support them in their transition to the NDIS.
So the Ethnic Communities Council of Victoria is the peak policy advocacy body for multicultural community organisations, and we're proud to have been the voice of multicultural Victoria since 1974.
Most of the people that access our services are really at the crisis end, whether that's that they're actually sleeping rough or they're escaping a family that's absolutely in crisis due to risk of violence. So it's really at the pointy end of the system where we're needing to respond immediately to the crisis.
We believe that there is certain ways that Australian society operates that means that certain things, accessing certain services, are more challenging for people from different backgrounds, and so our role is to encourage the government and encourage the community to be more culturally inclusive in the way that we operate as a society.
There's a range of specific and individual needs of the cohort. They've lived through extraordinary times of persecution and discrimination, and many older LGBTI people have never known a time when they felt safe to disclose or safe to be out. And widespread social stigma. Many people were expelled from their families and from their communities if someone found out about their sexual orientation, gender identity, and to some extent intersex status. So for many older LGBTI people, they have quite a profound fear of accessing health and human services, agencies and supports and care. Social isolation can be one of the things that they often face. Often they may not have contact with their biological family or family of origin, as we often call it, and rely on family of choice. But many older LGBTI people are quite socially isolated. Not all, but many are.
Disability service providers work with and alongside people with disability to support them to lead what is often referred to as an ordinary life. That's the aspiration, if you will. It's a model which I think working at its best is about the provider walking alongside rather than behind or in front of the person with disability. They provide a range of services including residential disability accommodation, supported employment services, community participation and inclusion services, one-on-one supports, group supports.
Look, first and foremost, it's taking that consumer-focused or person-centred approach to things. We know from research that if you actually understand the particular requirements of that person and their circumstances, you're more likely to get a better outcome, whether it's providing aged care or health care, disability care, and that will just land much better.
I think communication is a really important aspect. Communicating to staff and people within the service your broad commitment to becoming LGBTI inclusive and aware, and of course communicating to the community more broadly so that older LGBTI people can feel confident to access services and can expect to be to receive safe and inclusive services. Utilising the range of resources and information that's available out there. There's lots of information. There's been a multitude of projects and research undertaken in the past 10 or so years, which has really grown our knowledge of the needs and experiences of older LGBTI people. So access evidence-based information and research, as well as mixing that with trying to undertake some consultation perhaps as well. And if one resource that I can point services to is the Rainbow Tick Guide for LGBTI inclusive practice, which is available on the GLHV website. And most importantly, not treating everyone as the same. So often service providers say we're already LGBTI inclusive because we treat everyone the same, but we're all not the same. No one within the community has the same history and experiences which informs their needs. So ensuring, of course, looking at person-centred care and ensuring that the needs of the individual are catered for, regardless of their sexual orientation, gender identity or intersex status.
Being person-centred, actually asking the community and asking the person what types of care they want to receive and the best person to provide that care, and making sure that that person is included within that planning and implementation process.
So really responding to the clients without necessarily seeing only the challenging behaviours, but listening, actively listening and working from a response that doesn't require someone to retell their story. So collaborative care, it's really at the heart of what I would recommend to healthcare services, so that continuum of care can include the assessment carrying across all of those levels of the system so that the client story builds over time.